Prostate problems? Don't panic. Let's separate fact from fiction about the two significant prostate issues: benign prostatic hyperplasia and prostate cancer. So, let's get started. Did you know that benign prostatic hyperplasia hits 50% of men aged 50 to 60 and skyrockets to a whopping 90% by the time they reach 80? That's a substantial impact on the older demographic. Likewise, prostate cancer tends to be more common in older men, with approximately 6 in 10 cases occurring in individuals aged 65 and above. Age becomes a crucial factor in understanding the dynamics of prostate cancer incidence. Now, we are going to deep dive into the differences between BPH and prostate cancer. The prostate is a gland, and the urethra passes through it. The normal prostate in young men weighs around 20 grams. However, when a man has benign prostatic hyperplasia, this condition causes the prostate to start increasing in size, and as BPH occurs from the inside out, the urethra passes through the middle of the prostate. So, when there is an increase in the size of the prostate, problems with urination arise. There may be difficulty urinating. The flow is not as strong. Sometimes force is needed to urinate, and there may be dribbling in the underwear, leading to a slight incontinence. Often, the main concern is whether this is related to prostate cancer. It's worth noting that if there is a lot of symptomatic evidence, it usually is not cancer. The main symptom of prostate cancer is the absence of symptoms because it is silent. Therefore, when there are symptoms related to urination and difficulty urinating, it is more likely to be associated with benign prostatic hyperplasia. It's important to say that benign prostatic hyperplasia is completely different from prostate cancer. They do not turn into each other. Therefore, if the prostate enlargement is causing discomfort while sleeping, it is advisable to see a doctor to discuss treatment options, such as the use of medications like alpha blockers. A common test to assess prostate health is the PSA prostate-specific antigen test. However, it's essential to consider that various factors, such as intense physical activities, can influence PSA results. Additionally, there are different types of PSA, such as total PSA and free PSA, which can provide more detailed information about prostate health. The decision to undergo a biopsy should be carefully considered, as this procedure is not without complications. The biopsy may not detect cancer if it is located in an unbiopsied area, and there are risks associated with the procedure. In the case of prostate cancer, it's crucial to emphasize that in first world countries, the approach in patients over 65 is often observation, without the immediate need for surgery. This is because prostate cancer typically progresses slowly, taking 20 to 30 years to develop. Therefore, rushing to intervene may not be necessary, especially considering that most prostate cancers do not metastasize. Studies show that only 7% of prostate cancer cases present with metastasis. Furthermore, nutrition plays a significant role in prostate health. Lycopene, found in foods like cooked tomatoes, can help prevent and treat benign prostatic hyperplasia, and in some cases, even prostate cancer. I hope this conversation has clarified your doubts and provided useful information about prostate health. Feel free to discuss more details with your doctor. If you enjoyed this video and want to see more, be sure to subscribe and hit the notification bell so you never miss a new upload. Check the video description for some other products that you might be interested in.